So thanks very much for joining me, Brandon.
Of course. Thank you for having me. It's a pleasure.
Yeah. So, do you want to start just by telling people where you are?
Yeah, right now I live in Orlando, Florida.
Oh, right
But
on. I'm in St. Augustine.
yeah,
So
we're just right up
we could
I-4 and
be
a little up
hanging
95.
out. Oftentimes with people in sleep apnea, they where their story starts in hindsight is usually before when you actually got diagnosed. So do you know when your sleep maybe started not feeling quite right? Like, were you a teenager? Were you an adult? What was happening?
I was an adult. I mean, I think I really started to notice it not too long ago, maybe 2.5 years ago. Um, just really noticing that no matter how much sleep I got, I had so much excessive daytime fatigue, um, really crashing in the afternoons, and no amount of caffeine really even helped. At first, I kind of just chalked it up to, well, I'm in my mid 30s now, approaching my mid 30s at least. Um,
You're so
Maybe this is
young.
life. um, but I kind of struggle with that for about a year or so,
And
and
would you
then
say, like at that time, I think part of the problem sometimes in recognizing this stuff is how normal that seems to everybody else. I feel like everybody's drinking coffee to make it through the day.
oh, you're absolutely
Yeah.
right. Yeah, I'm like, oh, work is tough, and so I tried, the normal stuff, yeah, up in caffeine intake, like most people do, changing, sleep routines, even getting new mattresses and things of that nature, that most people do. Sleep apnea was the furthest thing from my mind.
Had you even heard of sleep apnea?
Yeah, I'm in the medical field, so
Okay.
I did know what sleep apnea was, but again, furthest thing from my mind because even though I'm in the medical field, I still actually subscribe to the misconception that people with sleep apnea are tend to be overweight snorers and
Yeah.
stuff, and that was not me. So
Right.
even being in the medical field, I had that misconception.
hmm
About a month or so before my son was born, and I kind of just had some internal dialogue with myself, knowing that I'm going to be stretched even thinner as a new parent. My sleep, is going to be interrupted and very sporadic. So it'd be, really dangerous, but also, really affects my quality of life and my enjoyment if I added sleep deprivation on top of my, already existing fatigue.
hmm
So I researched doctors in the area, and luckily I found Dr. Verma, who's located here in Orlando, and we were actually able to initially meet up via telehealth.
He a sleep specialist or
Yeah,
what kind
he's
of
he's trained. I think he's a neurologist by
mhm.
trade, but in training, but he specializes in sleep disorders. I'm not overweight. I had no history of snoring whatsoever. He's like, yeah, you got no risk factors, but it's possible. Then narcolepsy and so on and so forth. So we did an at-home sleep study first.
Home sleep studies are like my new favorite thing. I'm basically like a sleep apnea super nerd. So would you say like I had an at-home polysomnograph, right, where they put all of the electrodes on your head and a tech comes to set you up, and was it that or was it an abbreviated one where they just kind of have like a little cannula at your nose and
That
a thing on your finger?
the latter. So they had a
Okay.
pulse
Yeah,
ox on my
right
finger and
on.
just a nasal cannula. So
Yeah. So it
um,
doesn't give them as much data as a full sleep study would.
so it really didn't capture my condition.
So what
But
did they say after that test? Did you go back to get the results?
we did the results, over the phone. At this point, I still haven't gone in office because of COVID
COVID and
restrictions and everything.
yeah.
But it didn't show anything. But of course, he wanted to investigate it further. So that's when we did a in-house sleep study with all
Okay.
the electrodes and stuff that you were describing.
Okay. So you went overnight and stayed at a sleep center to do that.
Yeah, so I had a pretty extensive sleep study. I did an overnight one and then a
Mm-hmm.
daytime one, which basically they wake you up, you're up for a few, but then they're like, okay, take a
Yeah.
nap. All right, you wake you up, take a nap, wake up, take a nap.
Yeah.
So yeah, I was there for over 12 hours.
I'm really glad. It sounds like your doctor's really good at his job in the sense that I think that oftentimes people use the abbreviated sleep study which doesn't give all the data, and they just say it's not showing sleep apnea, and they just that's kind of the end, right? Whereas it's good that he actually kept asking questions and sent you for the fuller sleep study.
Right, exactly. Because even though the at-home one was negative, he's just like, I there's something wrong. What you're describing to me is not normal. So,
right.
He wasn't knowing that it's not 100%.
And so, what did that show when you did the full sleep study?
So I did the full sleep study and then had a follow up with him, and he's like, this is shocking, and you're going to be shocked, but you have sleep apnea. And I was like, what? So I had mild sleep apnea. So that was probably why it wasn't caught on the home one, because my apnea periods, I'm at the lower end of, the apnea score.
So did they tell you your AHI?
Correct me if I'm wrong. You know more about this than I do, so I'm just kind of beginning my journey. But is it 5 is the cutoff for the lower?
So 5 to 15 is generally considered mild sleep apnea.
Right. I believe I was 5 or 6. So I was like literally just over the threshold.
But I know I say this all the time to people that listen to my podcast, but I feel like the mild, moderate, and severe labels are not my favorite, just because you can have somebody with a very low AHI whose life is really impacted, who has a lot of symptoms and really struggles during the day to stay awake. And then you can have other people with a much higher AHI, and you think, oh, they have severe sleep apnea, but they're really not as impacted. So it's a very complicated condition. So they diagnosed you with the mild sleep apnea, and then what did he say about treatment?
So we went through all the available treatment options at that time, some being, the most invasive, like surgery, kind of opening up the back of the mouth, throat area. And given the risks of that and that it wasn't 100% effective, I was not interested in that at all.
Right.
So, of course, we went with the conventional standard of care of CPAP.
Okay. And so how did you feel about it when he first said, you would have a CPAP and wear this mask, and what did you think?
Oh, I was a little bit devastated. That's probably too big of a word, but I was kind of, just knowing that I'm a very, picky sleeper. I have to have a certain, sleep environment with white noise, darkness, and,
Same.
yes.
Yeah.
So I was really worried about, being on a CPAP and my ability to sleep. So I was, of course, I know it was, it's effective. So I was more than willing to try because I wanted to feel better. But I was really apprehensive in the fact of it negatively affecting my sleep even more.
And so how did it go?
Oh, it was a rough journey for sure. It went about as well as, it wasn't, I wouldn't call it a self-fulfilling prophecy, because I really did give it my all. Because at the beginning, I did have a few nights where I slept with the CPAP all night, and I felt much better in the morning. Like, I mean, it was a huge difference. So I'm like, all right, this is the problem. This is why I have to continue and try this and see this through, because it is helping. But as time goes on, it actually got worse. My biggest problem is actually, I would look back on the data, because everything was kept by an app. So I would wake up without my mask on, and I would look back, and then in the middle of the night, I would just take my mask off after like an hour or two after I fell asleep. So it was almost like I didn't even wear it.
Yeah.
The nasal pillows were more comfortable, but it didn't fit with my, natural way I breathe during my sleep.
So it didn't go well.
It really, we tried different masks. We tried, dialing down the pressure settings. And it was really, it went poorly.
Yeah. So how long did you struggle on with the CPAP?
6 to 8 months around there.
Okay.
So it was a long journey.
Yeah, you definitely gave it a try, right?
Right. I mean, in that point, like, the other option that was available to me was, to do something more invasive like surgery. And I did not want to do that.
Tell me about how you first heard about the eXciteOSA device.
So this was after the turn of the new year. I want to say in January or February. I actually got the first time I was actually in office to see Dr. Verma. And we were talking about the struggles of the CPAP and again, taking more measures to try and rectify the situation. And he's like, well, we're going to still try this, but let me show you about what I can potentially offer you in the future. And he actually had a prototype of it in his office. And he showed it to me, kind of gave me the rundown of it. And I'm like, this thing sounds too good to be true. So yeah. I'm like, okay.
That's why I'm so interested to talk to you, just because everything I've read and heard about it, I'm like, this does sound too good to be true. So tell me more.
Right. So I was like, all right. I was like, Dr. Verma, do you have if there's a waiting list or something, put me on it. Like I want called as soon as this thing is FDA approved. And that's what they are waiting on. He's like, they're all ready to ship and everything. They're just waiting on FDA approval. Mm-hmm. So I want to say another month or month and a half went by. And I just so happened to be, I wonder what the status is about this device. So I just Googled it, and like 2 days prior, it was FDA approved. So I was like, oh my God. So I messaged I messaged Dr. Verma like right away, asking about it. He's like, it's FDA approved. We're waiting to get shipment. He's like, you're top on the list. You're, number one or number two. It's like, once it gets in, we'll call you and you can come pick it up. So I was very anxiously waiting for about a week or so until I got that phone call.
So you go and pick it up, and can you explain to everybody like what the device looks like?
It's a very simple device. It's in two pieces. You have the mouthpiece, which has the electrodes and everything. And then you have, the main device that has the CPU and the chip and everything. So this communicates with the mouthpiece. A very lightweight, this, light as a feather.
Yeah.
So you plug them together in a micro USB connection. And then you log on to the app on your phone. Okay. And it connects via Bluetooth. And it programs, and it'll basically run you through your 20-minute session. Basically, the one thing that is customizable is the intensity. I think it goes from 0 to 20. And of course, at the very beginning, start as you're getting used to it, start a little bit lower. And I've personally kind of worked myself up a little bit higher. So then you sit there with the mouthpiece in for 20 minutes. It kind of cycles through different pulsing, like, more intense bursts.
So I think I'm trying to work out how to explain for people listening.
It's like a mouth guard for football, I guess, if you can think, if you're a sports person or something.
It's kind of plasticky, but like can bend.
Yeah. So this is
like it's not rigid.
The piece is all plastic, and the mouthpiece is all rubber.
So
it's very flexible.
Okay. So, and it has little, so I don't know if people out there know what a TENS machine is, but that's like how I'm kind of thinking of it, because if people have like a TENS machine for your back, it's the same technology, right?
It's exactly the same.
Yeah. So I actually had, so my little TENS machine story is that I'm from Scotland originally. And there, when people have babies, that all of the obstetricians just give out TENS machines for during, so that you can use it during labor. And so when I was here, like I moved here to Florida, and all the doctors are like, I don't know what you're talking about. I think that physical therapists use TENS machines, but we don't have any. And so I ended up having my mom smuggle a TENS machine like on a plane, because I guess like there you can just buy them, right? Like whereas here I think you're supposed to have a prescription. But
no, actually, like, you can buy them. We actually. So
maybe she didn't need to smuggle it. She just felt really.
Because we just bought one in case my wife needed it for her her most delivery. We brought it and she didn't need it, but so you can buy them off Amazon.
Oh, okay. Well, my mom didn't have to feel like she was smuggling anything. The TENS unit for your back has kind of pads that fit on your back, and so I guess like the eXciteOSA thing that you were just showing me, it's almost like similar pads but just smaller for your tongue.
Right. So there's no pad, like there's nothing. The pads are more or less stuck to the mouthpiece.
Yeah.
You can kind of see them. So you have two that'll kind of rest on the back of your tongue and two on the forefront of your tongue.
And when it runs, so it runs, you use it for 20 minutes a day for 6 weeks. That's the plan, right?
Right.
And so when it's actually running its 20 minutes, you're not actively doing anything, right? Like it's just kind of toning your tongue and strengthening your tongue without you having to physically do anything.
No, it's a very, very passive, very passive.
When did you start noticing, like, so you started doing this 20 minutes a day for the 6 weeks. Did you start noticing any difference in your sleep right away, or how long did it take?
They told me what they saw in the clinical trials, maximum benefit around 4 to 6 weeks. So that's kind of what I had in my head. About after a week, I started noticing a difference, but I was very hesitant. It's like, maybe this is more of a placebo effect. It's kind of in my head. I didn't tell, my wife I was feeling better or anything, because I didn't want to get too excited.
Yeah.
And then after 2 or 3 weeks, it was very sustained. So I'm like, I think this thing is working.
Yeah.
And, I was super excited, and, I saw tears in her eyes because she knows how much I've been struggling with this. So it was.
I suppose that the idea, like, you can just correct me if I'm wrong, but I suppose the idea behind it is a lot of sleep apnea comes from your tongue falling back in your throat and blocking your airway. So the idea of this is that your tongue doesn't do that because it's more toned and, like it's not loose and floppy anymore. Is that basically the idea?
No, that's exactly the idea.
So did you go back and do another sleep study, or you just felt better, so you just carried on with it? And
so the plan actually is to do another in-house sleep study. The time frame of that we're not sure yet.
Mm-hmm.
A lot of it has to do with somebody has to pay for it. And I've already had my diagnostic sleep study, so a follow-up sleep study, typically. So the Dr. Verma's office is working through that. So, once we get authorization, the plan is to repeat it to see if those sleep apnea episodes have gone away.
So as far as how you're feeling during the day, do you feel like your symptoms are completely gone, or do you still have residual sleepiness during the day, or what's happening with that? Is it really difficult because you have little kids and you can't?
Exactly. Well, I feel like my sleep my energy now correlates with my sleep. If I get 7-8 hours, I feel great. Obviously, if I'm up during the night with the kids, I feel tired, but that's to be expected. So
yeah, I think that's one of the biggest things with sleep apnea that I think is a clear sign that there's something wrong with your sleep. If you're getting 8 hours sleep, like that for me was one of the big things that finally made me go to the doctor, because even when my daughter started sleeping through the night when she was a baby and I was getting 8 hours sleep, I did not feel better. So I think that's one of the things that oftentimes people kind of overlook that, but like if you're not feeling rested after you've slept, that's not normal.
It's not normal. No, right. Exactly.
Oh yeah. So tell me about, once you've done that initial 6 weeks, so do you still do it for 20 minutes during the day?
So you can do it at any time during the day. That's what's great about it. So it doesn't have to be, in the morning, afternoon, or at night. It's whatever, fits your schedule the best. So I tried to make it very regimented so I didn't forget. So about an hour or so before it was lights out, that time, it's kind of decompressing time for my wife and I. Mm-hmm. So, again, it's a very passive process. So outside of talking, that's kind of hard to do,
right?
With the device.
So you could watch TV.
We watch TV, right. Read. We're all scrolling through social media anyway. So, obviously 20 minutes when you wake up, lunch break, whatever.
It sounds too good to be true, right?
It does. And I was a little bit of a skeptic too, because of that, but I'm a real patient. I'm not a paid spokesperson with the company. Yeah. I was apparently one of the first ones to be able to use this, get the opportunity to use this device. And it's really changed. I know it's a huge cliche, but it's changed my life. Mm-hmm. So I'm glad to be able to kind of spread the word on it. Of course, it may not be for everyone. CPAP obviously still has its role. It's still very effective. Right. Just like CPAP's not for everybody, this may not be for everybody. But
And
I
I
think
think sorry, carry on.
I was just to say, the thing that's great is that as sleep apnea patients, we've had very little choices. And in medicine, we always like to have choices because one size never fits all. So I think this is great.
And one size really doesn't fit all with sleep apnea. The more people I've talked to and the more I've read and studied, the more I realize it's such a multi-layered condition, which it really just depends on so many factors, and not everybody's anatomy is the same, and not everybody's arousal threshold is the same. So I totally agree with you. Like, the more things that we have available that people can try, the better. And I think one of the things that's exciting to me, you can't really say the word exciting, can you, when it's called eXciteOSA? But one of the things that I do think's genuinely exciting about it is at the moment it's FDA approved for mild sleep apnea, right? But they're also doing other studies into moderate and severe sleep apnea. So my hope with this device is people who have severe sleep apnea and are told normally oral appliances are just for people in mild and moderate sleep apnea, maybe this is the kind of device where it takes somebody's AHI from severe to moderate and then gives them some other options. Like,
I think that's a great point. Could you be possibly even use it in conjunction? So with CPAP, so if you need BiPAP, you can now go back to CPAP. If you're on high pressure CPAP, can you go back down on your pressure setting?
Yeah. So the last question I always ask everybody is, are there any silver linings to your journey with sleep apnea? Is there anything that you've learned that you didn't know before?
Let's say right now, I think the biggest thing that has changed is, of course, my outlook on sleep apnea as a whole, and who can it in effect. That's why I'm very happy to come on here, because I feel that being a male in his mid 30s, with a average or above average BMI, but not overweight, not obese, no family history of sleep apnea whatsoever, doesn't snore, but I have it. So something else I'm going to try and do is awareness, and I know that's probably something you definitely are big on too. Because people out there, and I feel bad because I've been there and you've been there, that are struggling day to day with this not even on their radar.
Yeah. So I think that's my whole goal in life, right? Is to raise awareness of sleep apnea. But I think that a big chunk of it is exactly what we were talking about when you first saw your doctor, that I think moving away from risk factors and moving towards symptoms.
Right.
So that's huge. I think that if we did that, especially in the medical community, because doctors, I think especially primary care physicians and GPs are not given a lot of training in sleep medicine, right? So they are essentially trained in, these are the risk factors, these are the people that we expect to have sleep apnea. Well, the problem is so many people are undiagnosed that there's actually a ton of people out there that don't fit any of the risk factors really for sleep apnea.
Right.
So,
and also from a mindset standpoint for patients, I think I felt it a little bit, when you're working hard, and it's sometimes hard to admit that you're tired because it shows weakness.
Especially among men.
Strong. Right, exactly. Yeah. So you want to fight through it, which again was part of my mentality too. But to know that it's okay to admit that you're tired, and like you said, really, if you are sleeping through the night, 8 hours of sleep, and you're not, you don't feel rested, that is not normal. You'll feel much better and feel much more like yourself when the problem is addressed.
Yeah. Well, thank you so much for joining me, Brendan. I really appreciate it.
Of course, it has been a pleasure. I appreciate you having me on.
Thanks so much for listening. I love hearing from you. If you'd like to be featured in an upcoming episode, please email me at sleepapneastories@gmail.com. That's also the place to get in touch if you just want to say hi or ask a question. Alternatively, you can always reach me on Instagram. My handle there is @Sleep Apnea Stories. If you're enjoying the podcast, please subscribe, rate, and review wherever you listen. This really helps a wider audience to find the episodes, and I really appreciate it.